Dr. Haber is definitely the person to come to if you want the right answers, quick answers, and somebody that truly cares to get you back to doing what you love to do.
He took my desperate situation at hand and dealt with me immediately.
He's smart, he knows what he's doing, and it's always nice to know that you have someone like that taking care of you.
For fun, I very much enjoy endurance type sports, for example, biking and running and hiking, that sort of thing. I also enjoy photography. I very much enjoy the whole process. It's creative, it's a chance to go take a vision, your own vision and picture of the world, and then with the technology that's available today to assimilate that and create something, and it's really fascinating.
Hello, Carolyn.
Hello.
Nice to see you. Nice
How
to
you
see
doing?
you. Good. How's your arm coming along?
You know what, it's good, and I hope you're
One of the passions that I have is actually helping people solve problems, because there's so many things in medicine that is chronic conditions where there's no cure for, or things that we can't really fix. Where in my business, there's things that we can actually fix and get people back and truly solve their problems.
I could feel it grinding and clicking and all sorts of things, yes.
Yes.
I very much enjoy dealing with people on the level where you can help them out with serious problems that are a part of their lives, and especially when it's, again, something that you can actually fix, because there's a lot of things that happen to people there isn't good cures for, and we end up just managing them. Certain medical conditions, but we actually get a chance to treat and fix problems, and I enjoy that very much about what I do.
Thank you so much, and
You are
thank
welcome.
you for all my movement. I owe it to you.
We have a lot of new equipment that we're using now, a lot of new technology. When I started training, most of the procedures were open, for example. Now we're using arthroscopic and minimally invasive approaches to solve those same problems. We get people back quicker, and the procedures are actually much less invasive and really more effective in a lot of ways.
And are you having any tenderness or pain in here?
No.
So that's where your meniscus tear is, and that feels pretty good.
One other issue that arises in my practice is that oftentimes orthopedic surgeons get the reputation that we want to operate all the time.
No tenderness there, right?
And in fact, many of the problems that I treat are non-operative, perhaps up to 90%. So John, just as a reminder, here is where we were before the repair. This is the rupture here, this is the gap, so that's where we were at that point in time. And then so we try to take an approach where we get people better without having to do an aggressive procedure, and that includes physical therapy, discussing lifestyle changes, discussing different ways that patients on their own can learn how to rehabilitate their injury, those sorts of things. A team approach to get people better without having to resort to a more aggressive approach.
I was more concerned that sitting at my desk all day as opposed to standing, and what I could do to take the pressure off my back.
At this facility, we also have a specialty sports physical therapy program where we have physical therapists that specialize in working with elite athletes, and they've worked with Division I and even professional athletes, and they're experts at rehabilitating injuries and getting people back after injuries without aggressive treatment.
And breathe out.
As your wellness orthopedic surgeon, you can be certain that I will take a team approach in solving your problem and in the least aggressive manner.
He always likes to show you exactly what happened, what the injury was, and exactly how he's going to fix it.
He wants to evaluate you as a person and make sure that surgery is a last resort.
He gave me a second chance. He actually gave me hope, and he gave me the use of my arm again.